Thank you for coming to my talk today. I'm going to be talking about preparing service providers to champion cultural safety and trauma-informed care into service delivery and practice. I'm Kim Miller, and I'm presenting on behalf of my collaborators, Stephanie Glegg and Jason Gordon. Online and didactic programs exist that aim to enhance cultural safety and trauma-informed practice. Most programs improve knowledge and may change appreciation of the importance of cultural safety and trauma-informed practice, but they may not adequately prepare participants to champion service delivery and practice change once they get back to their organizations. A need was identified to strengthen cultural safety and trauma-informed practice in the early intervention sector. So the purpose of the workshop that I'll be discussing today was to equip self-identified champions in the early intervention sector to apply knowledge translation theory and practice to support implementation of best practice in their organizations across BC. Jason Gordon, provincial advocate for BC-ACDI, was contracted by the Ministry of Children and Family Development to oversee the delivery of this training program. The curriculum was co-designed by an advisory committee of elders, families with lived experience, urban and rural service providers, and advisors with expertise in cultural safety and trauma-informed practice, education, and knowledge translation. This was a three-part training program. The first component was regional workshops for cultural safety and trauma-informed practice. And in this case, about 250 professionals attended 10 of two-day regional workshops across health authorities in BC. The workshops were intended to raise awareness and knowledge of the history and impacts of colonization and intergenerational trauma, and to introduce principles of cultural safety and trauma-informed care. At the same time, free online cultural safety and trauma-informed resources and training modules were curated and placed on the BC-ACDI website. And what I'll be discussing in greater depth today is a one-day interactive workshop for cultural safety and trauma-informed practice champions that followed the regional workshops. Participants submitted applications to be champions, and 5 were chosen from each health region to represent their organizations and their areas. In the Champions Workshop, adult learning principles were applied to introduce evidence-informed KT best practices and planning tools. We seated our participants in groups with their regional champion counterparts, so they were able to establish a network and a learning community. Our intention was to train our champions to be knowledge brokers, and we define that as the human force that makes knowledge translation effective. The knowledge translation planning process that we introduced was a systematic one that initially started with a needs assessment for establishing gaps and opportunities to enhance cultural safety and trauma-informed practice. This was followed by learning how to frame those key messages for action. What did they actually want people to do? This was followed by working within their regional groups to establish a KT goal applicable to their health regions. While when they went back to their organizations, they were probably going to set their own goals. Setting this communal goal allowed these groups to apply their training in a meaningful way. They then identified their audience, stakeholders, and used network theory to really leverage their initiative. Following that, they examined barriers and facilitators based on a behavior change framework, the theoretical domains framework, to support them in selecting knowledge translation strategies that were going to be suitable for their context and resources. Participants were actively encouraged to generate solutions to anticipated challenges, and this was a valued and important part of the workshop, so people didn't get bogged down by barriers. Participants had a summary of evidence-informed KT strategies to help them in selecting strategies tailored to these barriers. And finally, we gave our participants training and resources to support them in evaluating the outcomes of their knowledge translation initiatives and also their roles as champions in their organization. This is our post-workshop feedback, and you'll see our response rate was 88%. It was 6 managers, 9 therapists, and 7 other individuals that worked in the early development sector as child development and infant support workers. Overall, the quality of the workshop was rated as being very good, so 4 out of 5. In the next slide, I'll orient you. You'll see that there's a dark blue and a light blue. Those indicate agree and strongly agree, while the gray is neutral and the orange is disagree. What you'll see on the graph is the majority of the respondents agreed or strongly agreed that the content was useful for them in their roles as champions, and the curriculum met the learning objectives that were set out for the workshop. Over half of the respondents reported their level of confidence as a champion supporting change in practice consistent with cultural safety and trauma-informed practice was stronger following the workshop, and most really enjoyed the opportunity to network with other champions. Those who stated that they weren't so sure about their confidence wanted more trauma-informed practice and cultural safety training. And some shared that they found the one-day intensive was a lot to take in and might have enjoyed a more distributed learning strategy where they had more time to process and more opportunities for continued learning. In the next slide, what I'm showing you is the perceived ability post-workshop to do some of the skills that we were teaching people. And in this case, the dark blue means confident and competent. The blue means they're knowledgeable. Whereas when you get into the gray, we're getting into requiring more training. What you'll see is the majority could describe their role and value as champions, and most perceived that they were quite knowledgeable in this space. A majority felt confident and competent in finding the tools they needed for knowledge translation, cultural safety, and trauma-informed practice. And most could identify KT strategies that were best suited to their context. In the final category, developing that tailored KT strategy, most respondents indicated they would have benefited from more training, practice, and feedback to really feel confident and competent in making practice change aligned with cultural safety and trauma-informed practice in their organizations. So what have we learned from all of this? Well, we learned that if you wanted to do a similar approach to what we've done here, the Champions workshops applying evidence-informed knowledge translation tools can increase the confidence of your champions and can make champions more knowledgeable about the sorts of strategies they can use to implement best practices in their organization. However, one-day intensive workshops may not be quite enough to really make people feel confident and competent in developing their KT plans, particularly when they're trying to tailor it to the barriers they're experiencing when they return to their organization. Following up with coaching or other supports can really help champions to better champion that translation into service delivery and practice. So in this case, Jason Gordon facilitated a community of practice with meetings of regional groups and the larger group to share experiences and really support each other as they went about trying to make practice change. We followed up with our champions with a check-in survey approximately 8 months later, and about 15 of the 25 people responded. Over 75% really felt they could describe their role and value as champions, and most were feeling confident about identifying KT strategies that they could use in their context. They described a number of strategies and initiatives that they were already introducing into their organization. Simple strategies like acknowledging land to more involved strategies that really made a change to the services that they were providing. They most continue to feel that they would benefit from more training, really, to address the barriers to implementing cultural safety and trauma-informed practice. And there is plans that are in place to perhaps provide more coaching in this space. And of course, most suggested that having dedicated time to do what they were trying to do in terms of these initiatives was a challenge. So I'm leaving you with more information about the resources that we used. The first is the BC ACDI, Cultural Safety and Trauma Informed Practice Resources, and that's in the training plan project part of their website. And the KT Tools and Resources, these are in the evidence based practice resources section of the Child Development and Rehabilitation website. And I want to alert you that this will be changing because we're redesigning this for the fall. And otherwise, I look forward to talking with you in the breakout rooms and answering your questions. Thank you very much.